But the main thing is that 8 weeks after osseointegration is completed, then you can go for final rehabilitation. As you can see, the emergency profile is already set. Now, what are you going to do next? You will continue your digital workflow. You will not cut this digital workflow in two. Now, the only thing that you're going to have to do here is to place a scan body and do a digital impression over here. And now you can see on the left side your planning, and on the right side the CBCT with the implant placed, and you can see the accuracy of the surgical guide. It's basically hit on the spot that you plan. So for me, there's no better example that how digital technology will come to help you than the lateral incisors. I mean, you can look left and right. You can see implant position left and right. Question: would you be able to do this freehand? Sure, but how many failures did you saw in your clinic about freehands in these lower lateral incisors? Huge amount. You become better because you decrease the error, and by decreasing the error, patient becomes happy, socially happy, and you're better off. So what you're going to do now is restorative dentistry. You are going to complete the cycle. You're going fully digital again. So in this type of situation, you have two steps where you want to go. First, you do the scan body impression, and then you send it directly to a monolithic situation kind of zirconia that you have from a block. You have a tooth and it's ready to go. But the downside of doing that is that blocks only have monochromatic colors. That means A2 is A2. Even if you try to characterize with some glazing situations, it's not the same thing that when you need characterization from the feldspathic veneering material. So the second situation where you can have is to have a model where with the analogs, where your ceramist can feldspathic veneering your zirconia framework, and that's what we did in this case. So because there's a lot of characterization in these tools, we're not going to have a block in here, otherwise it would become aesthetically unpleasant. You are going to produce the models. Now, a couple of years ago, we didn't have any material for dental models, but now we have. Now, Formlabs, the 3D printing machines, also launched a lot of new products, and one of the products that they launched was the for implant dentistry models. And in this situation, you just place your digital analogs into your 3D printed models, and by doing that, you have now a 3D printed model. Now, the big advantage is the accuracy and the detail that these models have. They don't have nothing to do with cast. I mean, I love cast for years, but now we don't use cast anymore, especially for some situation, because look at this example of these models, the detail. Now you can take it out the teeth like a Geller model cast type of impression, and you can check the contact points, and the lab technician says thank you for that, because now you can do a very nice job over these models. So we printed both, one for photographic purposes, the other one for the real patient, and you can see that now you just have to do a lab work. Now the lab work can go and give free imagination to do 2 separate crowns. That case is completed. So from digital planning, digital thinking to the end product, we see here a major shift in dentistry, because we don't have any more analogical impressions, and everything is built on detail and accuracy. So we're better at surgery because you're faster and accurate, and we're better at your prosthodontic position because you're also better and accurate. You don't have the mistakes of silicones, you don't have the mistakes of casts. So everything is CAD/CAM from the first to the last day, and that is huge. So here you have an overview of the situation. You have 2 lateral incisors just about the same as the central incisors, and the patient says, okay. Of course, you can do veneers in here, you can do everything, but this is a 70-year-old patient, a granny that just wanted 2 lateral incisors. You're not gonna place them very wide. You're just going to follow the rules. And this is a perfect example that by doing everything together, you have a nice result.